Burnout. Signs, symptoms, and overview. What are the signs and symptoms of burnout? Burnout is a state of physical, emotional, and mental exhaustion caused by prolonged stress, often related to work or caregiving. The signs and symptoms can manifest in various ways and affect different aspects of a person's life. Here are the key signs and symptoms. Emotional symptoms. Number 1, chronic fatigue, feeling physically and emotionally drained most of the time. Number 2, irritability, increased frustration and a lower tolerance for stress or minor irritations. Number 3, cynicism or negativity, a pessimistic attitude, often feeling like things will never get better. Number 4, detachment, feeling emotionally numb or disconnected from work, colleagues, or even loved ones. 5, feelings of hopelessness, a sense that nothing can change or that your efforts are pointless. Physical symptoms. Number 1, chronic exhaustion, a constant feeling of tiredness regardless of how much sleep or rest is taken. Number 2, headaches or migraines, frequent headaches or a sense of tension in the head or neck. Number 3, sleep problems, difficulty falling or staying asleep or waking up feeling unrefreshed. 4, frequent illness, increased susceptibility to colds, infections, or other health issues due to weakened immune function. Number 5, changes in appetite, either a loss of appetite or overeating as a response to stress. Cognitive functions. Number 1, difficulty concentrating, struggling to focus on tasks or remember things, leading to a decrease in productivity. Number 2, forgetfulness, becoming more forgetful, missing appointments, or making errors in everyday tasks. Number 3, reduced performance, feeling that you're not performing at your usual level, both professionally and personally. Behavioral symptoms. Number 1, social withdrawal, avoiding social interactions both at work and with family or friends. Number 2, procrastination, putting off tasks or delaying important work due to lack of motivation. Number 3, decreased motivation, a lack of enthusiasm for tasks that were once enjoyable or important. Number 4, overworking, despite exhaustion, continuing to push yourself to complete tasks or to prove your worth. Impact on personal life. Number 1, decreased job satisfaction, feeling disconnected from your work even if you once enjoyed it. Number 2, strained relationships. Burnout can cause tension with coworkers, families, and friends because of irritability, emotional withdrawal, and reduced energy for social interactions. Number 3, loss of passion, a general feeling of having lost interest in things you once cared about or enjoyed. Burnout can affect anyone, but those who face high job demands, lack support, or feel little control over their work are more vulnerable. Recognizing these symptoms can help in taking steps to recover and prevent further mental and physical strain. Can burnout cause physical and mental diseases? If so, what are they and how does burnout cause them? Yes, burnout can lead to both physical and mental health conditions. If left untreated, chronic burnout weakens the body's ability to manage stress and can exacerbate or contribute to the development of various diseases. The persistent state of stress that comes with burnout has physiological and psychological consequences. Here's how burnout can lead to these issues. Physical health conditions associated with burnout. Number 1, cardiovascular problems. How it happens. Chronic stress increases levels of cortisol, a stress hormone, and adrenaline, which can elevate blood pressure and heart rate. Over time, this can contribute to heart disease, hypertension, high blood pressure, and increased risk of heart attacks. Conditions: hypertension, heart disease, arrhythmias, and increased risk of stroke. Weakened immune system. How it happens. Chronic stress and burnout compromise the immune system, making the body less effective at fighting infections and illnesses. Conditions: increased susceptibility to colds, flu, and more serious infections like pneumonia or bronchitis. People may also experience longer recovery times from illnesses. Chronic fatigue syndrome. How it happens. Prolonged burnout can lead to persistent physical exhaustion that doesn't improve with rest. This condition often overlaps with burnout symptoms and is characterized by severe chronic fatigue that lasts for months. Number 2, conditions: chronic fatigue syndrome, CFS, which causes debilitating tiredness, headaches, and muscle pain. Gastrointestinal problems. How it happens. Stress impacts digestion by altering the balance of stomach acids and the movement of food through the digestive system. Conditions: irritable bowel syndrome, IBS, acid reflux, stomach ulcers, and digestive issues. Sleep disorders. How it happens. Chronic stress interferes with the body's ability to regulate sleep cycles, leading to insomnia or poor quality sleep. Conditions: insomnia, sleep apnea, and general sleep disturbances which worsen fatigue and impair cognitive function. Musculoskeletal issues. How it happens. Stress causes the body to tighten muscles, particularly in the neck, shoulders, and back, leading to muscle tension and pain. Number 2, conditions: tension, headaches, back pain, neck stiffness, and joint problems. Mental health conditions associated with burnout. Number 1, anxiety. How it happens. Burnout often causes feelings of constant worry, apprehension, and a sense of being overwhelmed. The body's stress response, fight or flight mode, remains activated, which leads to heightened anxiety levels. Number 2, conditions. Generalized anxiety disorder, panic attacks, and social anxiety. Number 2, depression. How it happens. The emotional exhaustion and hopelessness caused by burnout can lead to persistent feelings of sadness, loss of interest, and despair, which are hallmark symptoms of depression. Conditions: major depressive disorder, mood swings, loss of motivation, and a decreased sense of self-worth. Post-traumatic stress disorder, PTSD. How it happens. In cases of extreme burnout, especially when it's linked to trauma or highly demanding environments, such as caregiving, emergency services, or military, burnout can evolve into PTSD characterized by intrusive memories and emotional numbness. Conditions: PTSD symptoms may include flashbacks, nightmares, severe anxiety, and difficulty in managing day-to-day activities. Impaired cognitive function. How it happens. Burnout impairs the brain's cognitive functions, especially memory, concentration, and decision-making abilities. The constant mental strain can lead to brain fog, where thinking feels clouded or unclear. Number 2, conditions. Difficulty focusing, forgetfulness, and decreased ability to make decisions. Emotional dysregulation. How it happens. Chronic stress from burnout may overwhelm emotional regulation mechanisms in the brain, leading to heightened emotional reactions and difficulty controlling one's emotions. Number 2, conditions. Increased irritability, anger outbursts, mood swings, and a general sense of emotional instability. Substance use disorders. How it happens. To cope with the overwhelming emotional and physical toll of burnout, some people may turn to alcohol, drugs, or unhealthy behaviors like overeating to numb their feelings or seek temporary relief. Number 2, conditions. Alcoholism, drug abuse, and unhealthy eating behaviors like binge eating. Number 4, how burnout leads to these conditions. Number 1, prolonged stress response. Burnout is a prolonged activation of the body's stress response. The fight or flight system. Over time, elevated levels of cortisol and adrenaline can damage bodily systems, especially the cardiovascular and immune systems. Number 2, disrupted neurotransmitter imbalance. Number 2, disrupted neurotransmitter balance. Chronic stress leads to imbalances in brain chemicals, neurotransmitters like serotonin and dopamine. These chemicals are responsible for regulating mood, sleep, and emotions, and imbalances can lead to depression, anxiety, and cognitive problems. Reduced coping mechanisms. As burnout continues, the brain's ability to regulate emotions and manage stress diminishes. This causes individuals to experience emotional and physical exhaustion and struggle to cope with normal daily challenges, leading to various diseases and mental health conditions. Lifestyle factors. Burnout often leads to neglect of self-care, poor nutrition, lack of exercise, and poor sleep, all of which exacerbate both mental and physical health conditions. Poor lifestyle habits become a vicious cycle that worsens the effects of burnout. Prevention and treatment. Recognizing burnout early and taking proactive steps to address it is essential to avoid the development of serious health issues. Treatment may involve lifestyle changes, therapy such as cognitive behavioral therapy, medication for conditions like anxiety or depression, and strategies for stress management like mindfulness, meditation, and physical activity. If burnout is leading to severe symptoms, seeking professional help is critical to preventing long-term health complications.